This presentation will help prepare you for what to expect after your joint replacement surgery, including while you are still at the hospital. Following your surgery, you will be transferred from the operating room to the recovery room and may be started on a combination of pain and anti-inflammatory medications. If you are staying overnight at the hospital, you will be transferred to the surgical floor once your vital signs are stable and you have started to feel sensation and are able to move your legs. If you are going home the same day of surgery, we will make sure you have the equipment and the information you need to be prepared for what to do and what to expect once you are home. Your incision will be covered with a surgical dressing that will need to remain clean and dry. Instructions about how to manage the dressing after your surgery will be provided. At home, applying ice to the surgical area should help relieve pain and swelling. Be sure to place a barrier, like a towel, between your skin and the ice source. Ice should be applied for 15 to 20 minutes and should be removed for at least 15 to 20 minutes before being reapplied. If you have had hip replacement surgery, your doctor may have you avoid certain movements. These precautions will be explained to you by your doctor before the surgery and by the physical therapy staff after your surgery. To help manage your pain and keep you comfortable after surgery, you will be asked frequently to rate your pain on a scale of 1 to 10. Note the facial expressions on the scale. This may help you accurately rate your pain. Controlling your pain is important so that you can get out of bed, walk with a device, participate in physical therapy, and perform activities of daily living. Following your surgery, you will most likely be given pain medication through an IV. Shortly after, this will be stopped, and you will then take pain medication by mouth. Side effects from anesthesia and medications are common and can include nausea, vomiting, constipation, loss of appetite, unsteadiness, and dizziness. It's important to tell caregivers, family members, and those who may be with you after surgery if you are experiencing any of these symptoms. Make sure your caregivers are aware of your symptoms so they can give you medication to control any side effects and help keep you safe. Blood clots can occur as a result of surgery, limited activity, and/or stopping blood-thinning medications. Depending on your medical history, your doctor may prescribe anticoagulant medications to help reduce the risk of blood clots following your surgery. Examples of these medications include Coumadin, Plavix, Lovenox, Xarelto, Eliquis, and aspirin. Performing ankle pumps 10 times per hour and wearing compression stockings can also help prevent blood clots from forming. An incentive spirometer is a handheld medical device used to help post-op patients improve their lung function. You will be trained to take slow, deep breaths into the spirometer to help improve lung expansion and strength. There is a ball that sits in the chamber of the device, and the objective is to make the ball stay in the middle of the chamber. If you breathe too fast, the ball will shoot to the top. If you breathe too slowly, the ball will stay at the bottom. We recommend you try to perform this exercise 10 times an hour each day for several days. Most patients undergoing a hip or knee replacement will return home the same day of surgery. However, if it is felt you need additional monitoring or recovery time before returning home safely, your surgeon may have you stay overnight at the hospital. As mentioned earlier, it is very important that you have a coach or someone at home for the first few weeks following surgery to help you with everyday activities and help make sure you are safe. Be sure your coach is able to care for you. If you are returning home the same day of surgery, make sure your coach is with you to discuss discharge instructions with our nursing staff. Your coach will also need to drive you home after surgery. If you stay overnight, a case manager and rehabilitation services will see you in the hospital to help ensure that you have a seamless discharge to home. As you plan for your return to home, make sure you discuss with your physician when you can bathe or shower again. This will most likely depend on your overall balance and your incision dressing. Following your surgery, and once the anesthesia has worn off, the goal is to have you stand and walk with help from the nursing staff or physical therapy, also known as PT. PT will help ensure you can walk using a walker, cane, or crutches, and will teach you how to perform specific exercises. To help ensure a strong recovery and to avoid stiffness, it is critical that you perform your exercises as indicated by your therapist. The hospital staff will encourage you to sit in a chair rather than lying in bed. This helps improve your strength, endurance, and lung function. If you have hip replacement surgery, there may be precautions you will need to follow. Your surgeon and physical therapist will tell you what these are. An occupational therapist may also see you following surgery to make sure you can perform activities of daily living and to identify any devices or equipment needs that may have not been identified prior to your surgery. Once you are discharged home, You will continue with outpatient PT or home health PT services. Outpatient PT occurs 2 to 3 times per week for 1 to 2 months. Each treatment session lasts about an hour. One of the goals of our program prior to surgery is to help ensure you have the equipment and services you need to help promote your recovery. A patient navigator will call you to review what to expect from your surgery and to identify equipment you may need to negotiate your surroundings and help prevent falls. The navigator will also help schedule rehabilitation services following surgery. The most common pieces of equipment include a rolling walker, elevated toilet seat, and tub or shower chair. If you do not own a rolling walker, one will be provided to you from the surgeon's office during your visit prior to surgery. Insurance will sometimes cover the expense for these devices, and if not, they can be purchased at a medical equipment supplier, pharmacy, or big box retailer. The hospital pharmacies located in Tidelands Health hospitals stock some equipment for purchase. Once you are home following surgery, it is very important to monitor yourself for certain symptoms that require prompt attention. If any of these symptoms occur, please contact your surgeon's office. Chills or fever, equal or greater than 101 degrees. Sudden increase in pain that is not relieved with pain medications. Signs of infection, including redness, swelling, tenderness, yellow discharge, or foul smell at the incision site. Separation of edges of the incision site. Nausea or vomiting. Pain, tenderness, and or swelling in your calf. Shortness of breath, chest pain or tightness, burning or itching when urinating. If any of these symptoms occur, please contact your surgeon's office during business hours. After hours, call the appropriate hospital and ask the hospital operator to page the physician on call. After you have had total joint replacement surgery, it is important that your healthcare providers are aware you've had the surgery, especially before you have any other procedures. It is common to prescribe antibiotics before other procedures to help minimize the chance of infection in your new joint. This includes procedures like dental work and colonoscopy. If you have any questions or concerns, please call us at 843-652-8160. Thank you for your time and attention during this important presentation.